Let's talk about what mandates have done. This is the Vaers reporting system and how many deaths were reported to Vaers by year. The blue is all non-COVID vaccine deaths. The red is reports of death related to the COVID-19 vaccine. This is 2021, this is 2022. The total reports following COVID-19 vaccination by year. As you can see, the first year that the FDA gave the emergency use authorization, it was 10,596. It rapidly increased in 2021 to 700,194. 2022, 206,673. And what happened? Mandates went away during 2022 and are still being forced in some places, but are much less. But in 2023, the numbers are 44,680 so far. This was dramatic. In 2020, the same year that the FDA gave the emergency use authorization, COVID was the #2 highest reported vaccine injuries and deaths on Vaers. But easily it went to #1 in 2021 and obviously #1 in 2022. Let's talk about the things that have been reported. Characteristics on the reports. Death, 17,432. Permanent disability, 17,142. Hospitalization, 81,931. Emergency room and office visits, 310,040. Serious adverse events, 107,722. What else has happened? Let's compare the Vaers COVID and flu vaccine reported deaths by days to the onset of all ages. Days of onset, COVID vaccine rapidly reported that death happens immediately after the vaccine. Flu vaccine, much lower rate. If anyone's wondering why there's vaccine hesitancy, look no further than the Vaers reporting system, because many of these people's stories were taken off of social media and censored. These people were called conspiracy theorists when they talked about this happening to their family or their friends. Reports on menstrual and hemorrhages by year. If anyone wants to understand what this has done to women, and Ms. Williams, I have great sympathy for you being let go by ESPN for refusing a COVID vaccine, and you should have never been fired for that, but you were right. You were right to listen to your doctor. There's been serious reports of changes in women's menstrual cycle and hemorrhages. Here's 2020 again. That's the same year that emergency use was given for the COVID-19 vaccine. Reports of miscarriage. Ms. Williams, you were right again. Miscarriages increased drastically, but yet no one seems to want to listen to these women. It's shocking. Myocarditis and pericarditis reported. 2021 and 2022, hardly ever reported before vaccine mandates, COVID-19 vaccine mandates. Does anyone want to know why people don't want to join the military until the mandates were taken away? That's it right there. This is not a conspiracy theory. Let's talk about heart attacks reported within days of onset. Heart attacks, this is the highest amount right within the first day to the second day of receiving the COVID-19 vaccine. What did the Pfizer execs know? They did not test if the COVID-19 vaccine would prevent transmission before release. Mr. Chairman, I just need a little more time. Dr. Burke says she knew the COVID vaccine would not protect against infection, but yet mandates were forced. But what about people and their stories? Here's a comedian, Nick Nemiroff, dead at age 32. He said, "I will not get the third shot. I will not. Pfizer me once, no shame. Pfizer me twice, shame on COVID. Pfizer me 3 times, shame on you. You want me to get a third shot? What's next? A 5th? No, thank you." Then he died, age 32. What about all the athletes? This Shane Warne, get your double vax and get on with it and learn to live with it. Australian cricket legend Shane Warne dies in his sleep. What about the young kids? Teen equestrian star Sienna Knowles hospitalized with blood clots after Pfizer vaccine. The stories go on and on and on. But I'll leave you with this. From February 21 to March 2020, millennials experienced the equivalent of a Vietnam War. A Vietnam War. With more than 60,000 excess deaths, the Vietnam War took 12 years to kill the same number of healthy young people we've just seen die in only 12 months. Mr. Chairman, I yield back. Thank you.